are in the era of AI, artificial intelligence. Well, when the amount of information is clearly outpacing what we as human beings are able to process, you know what? AI may be actually an amazing tool. Although there are some clinicians and even people within the general community who may have some fear regarding AI, it is here to stay. In fact, we very frequently are hearing things like AI will not replace your job, but people who know how to use AI certainly will. If this is going to give me a competitive edge to be able to improve my diagnostic treatment strategies, and even the ability to interact with my patients on a regular basis, sign me up. It is not demonstrating that I have an insecurity nor an ignorance or lack of knowledge by being able to supplement what my skill set as well as my bandwidth may be in order to more optimally diagnose, treat, and continue to follow and partner with my patients. Now, what are we seeing in regards to the current landscape? Well, I would say the earliest introduction that we've seen with AI is definitely utilizing automatic scoring for polysomnographies. How is this helpful? Well, when looking at what is the current working landscape and the number of sleep physicians that are available and a number of technologists, we very frequently are in an imbalance of how many sleep clinicians and technologists are available based on the need of the general population and the number of studies that may be coming in. This is being an augmentation of our bandwidth and our ability to drive, number one, more equitable care, but number two, more accessible care. Now, some of the limitations here may be the individuals who maybe their studies are a little bit divergent from what we normally would expect. Perhaps individuals who may have other factors that may contribute to differences in their EEG or what their breathing patterns are. However, like all models of AI, we see with the more exposure that they're getting to the different variations that they're better at identifying that there are some of these nuances. So when I'm looking at the use of the current state of AI, I would say that the use in polysomnographies represent a relatively good use case of how I can now repurpose, say, a technologist time from scoring a study to actually being present with a patient in need of doing a mask adjustment or performing a multiple sleep latency test or being on a phone call to be able to help an individual to be able to best suit the needs that they have at that time. So I would say there's definitely not a limitation when we're looking at how are we reconstructing the use of the time that may have been used to do some of these other tasks. Now, what would I be most excited about when talking about AI? It actually has nothing to do with only being in the sleep space. What my hope is with AI is being able to better marry day and night. We see that although we're having AI being applied to things like polysomnography to be able to score, my ideal state would be saying, how do I apply AI to other models of evaluations in other areas of medicine? What do I mean? What if instead of a polysomnography, we have an EEG, an electroencephalogram, and the AI model not only is telling you about, are you at risk for seizure, but is saying, hey, epileptologist, do you think this patient may have insomnia or obstructive sleep apnea? Or better yet, instead of the delay of up to 20 years for a diagnosis of narcolepsy, the EEG is concerning for sleep onset REM period, very disrupted nocturnal sleep, inappropriate sleep intrusions across this ambulatory EEG. Have you considered a hypersomnolence disorder? Perhaps the excessive daytime sleepiness that you're seeing in your individual who you're treating with pharmacoresistant epilepsy is not due to the polypharmacy. Perhaps there's something else going on. Can you imagine a world where AI is able to be your partner and being able to best treat the person in front of you? That is the future of AI that excites me.